My name is Stephen J. Morris. I'm a physician and a gastroenterologist. I'm chairman of the National Coalition and managing partner and founder of Atlanta Gastroenterology Associates. Our group is one of the largest gastroenterology groups in the United States, comprising about 50 physicians, covering over 5 million lives in the greater metropolitan Atlanta area. One of the most important parts of our organization's function is performing colonoscopy as a screening and preventive tool in the diagnosis of colorectal cancer. As many of you may know, colorectal cancer is the second leading cause of cancer deaths in the United States. It occurs equally in men and in women, and that's one of the things that makes it so deadly. However, it is an eminently detectable, treatable, and curable disease if found early. It appears that most colon cancers start in colon polyps, which can be safely removed via a technique called colonoscopy and polypectomy. This is a technique that's been around for at least 3 decades, but one of the things that we've realized is that many patients who should be screened starting at age 50 or even younger are not. One of the things that we try and do at Atlanta Gastroenterology Associates is network with our primary care physicians, our OB/GYN specialists, and consumers directly to make them aware of this disease and to try and come in for detection and early colonoscopy when they turn 50 or 45 in the case of African American males. We have multiple outpatient settings for our patients. This provides the procedure at a very cost-effective price. It is much cheaper than going into the hospital. We have state-of-the-art technology. We are very, very concerned with patient comfort and provide in every room an anesthesiologist or a certified nurse anesthetist to administer a drug called propofol. We all feel this has been the greatest advance in colonoscopy in the past 25 years. Patients are put to sleep quickly. They wake up quickly with no side effects and are able to resume most of their normal activities for the day. By providing the state-of-the-art screening colonoscopy and polypectomies in an outpatient setting, we are able to provide for the patients a quick, easy, and inexpensive way to get their screening done. The other thing with colon cancer screening is when you have it done and everything is fine, you do not need another screening for 5 to 10 years. So this is not something that has to be done every year. It's a singular event, and then many years can pass until your next screening with a great assurance that you do not have colon cancer or any predilection for colon cancer, such as a polyp that may be growing. In Atlanta Gastroenterology Associates, we do not also believe that you should have to wait a long time. We are very concerned with getting patients in quickly so that when they are referred for screening colonoscopy, they do not have the anxiety hanging over their heads. We feel that most doctors should make this examination available within a short period, a reasonable period of time, and patients can then be adequately educated in colonoscopy, have the procedure done, and certainly we want it to be a procedure that you would then recommend to friends, family that are in an age range that are susceptible to colon cancer. We feel that word of mouth among consumers and patients, our clients, is the most effective way to get the word out to the community that this is a disease that, while terrible, if found late, is preventable and